Hello, this is Dr. Eric Dein reporting for Room Now at ACR Convergence 2020, reporting here from Baltimore, Maryland, just north of the home city of it, being done virtually, but out of Washington, DC. So excellent poster sessions this morning. I wanted to draw everyone's attention to the healthcare disparities posters that were available this morning and still available on the website. There were a couple very important, excellent posters. The first one, abstract 0049 by Dr. Sun out of University of North Carolina. They took a look at disparities in patient portal usage among patients. So Dr. Sun looked at patients in their system of Epic, which patients went ahead and activated MyChart. As you may expect, there's large disparities as to which patients were able to access it. So in rural areas, minority, racial, ethnic groups, older age were associated with decreased health usage, decreased activation of their MyChart. Also, lower income, Medicaid, and non-English primary language were also associated with decreased activation. I think it would be very important to look at not just the activation numbers, but to see it in addition, how many patients were actually utilizing it, to what degree they utilized, particularly as we're using more and more telemedicine and remote learning. I think that's going to be an area that we have to be mindful and explore. The other study, abstract 0045 out of WashU, was a great study, just a quick survey of 132 providers that I think just hit on a very important point, looking at confidence in providers in evaluating lupus-related rashes in patients with skin of color. Across the board, providers said that they felt uncomfortable or less confident in assessing patients with lupus and recognizing lupus rashes in non-Caucasian skin tones. So this is something that I think expands beyond the dermatomyositis rashes or the classic erythema. It may look hyperpigmented, it might look different in dermatomyositis, and all sorts of different autoimmune-related skin rashes are important to be comfortable in all patients in all skin tones. So 93% of those surveyed said they would want to learn more about rashes in patients of color. And if you think back to your educational materials, pretty much all the photographs are of Caucasian individuals. So that's something that I think was a great thing for them to call attention to, and something else for us to think about as we were developing and changing our education moving forward. This is Eric Dein checking in from the Healthcare Disparities poster session. I look forward to talking to you more throughout Room Now.